Hey guys, Brian Cade here with Cade Fit, a fitness and self-development center where we help people get more out of their bodies and more out of their lives. One of the things I want to talk about today is pain and movement and soreness, because there's a lot of misconceptions out there, and it actually really frustrates me because most of the time people come in and gauge how effective their workout is by how sore they are and where they're sore. And that's one of the worst ways to decide. And also, people come in and tell us all the time that they have shoulder pain or back pain or knee pain, whatever it is, and that's just a normal part of the lifting. It's because they're old and whatever. And so we hear people come from other programs or different things where they're just sore every day in like their low back after deadlifting. And that's actually a sign that certain muscles aren't working. If you are having pain or chronic aches while working out that just nag you like a shoulder or an issue in the hip, it's a sign that something's wrong in the body. It's a sign that you're not moving right and that you should stop and figure out what's going on. All the time we have people come in and tell us, I can't do squats, shoulder press, deadlifts, whatever it is, because of some sort of issue like hips, knees, back, whatever. And most of the time, within 30 minutes, we can get people to work and use the right muscles where they don't hurt anymore. Remember, pain is a sign that your body's not moving the way it's supposed to. It's not because you're old. It's not because you've had previous injuries. It's because your body didn't get back to the movement it was supposed to. And with proper exercise, you can do that. So I don't care if you're working with us or somebody else, but make sure you really know who you're working with and if they're trained or not in getting you to move better. I see trainers all the time prescribing exercises and different movements that actually are damaging long term. So one, you want to see if are they correcting your technique regularly. There's a lot to technique that we spend tons of time dialing in with our clients so that they can move better. And the second thing is, when you have soreness or injuries, how does the trainer respond? Do they show you ways to help recover? Do they show you things that help activate muscles? Because if we do ever have somebody that comes in and is sore or something, we have a modification and a way to get them out of pain and moving better. And just to be clear, we're not treating pain, we're not fixing pain. We're getting the body to use the muscles that are supposed to be working so that it puts less stress on the body. Today, as we go through this video, we're going to cover 3 main points that relate to soreness and pain and how it affects your workouts. So tip number 1 is that soreness is a terrible sign of a good workout. In the beginning, when you start training, it is normal to be sore. You can actually avoid that if you start out slowly, get your body ready for exercise and move into it. But if you do get sore, it should happen for the first week, maybe 2 tops. But after that, your body doesn't get sore anymore. It only gets sore when you put a stimulus on the body that it's not ready for or hasn't done in a while. So if you've been doing squats and deadlifts for a really long time, working out regularly, and then go to lunges, you're going to be really sore the next day. But if you've been doing, say, lunges, squats, deadlifts, shoulder press, push-ups for a regular basis, your body's going to get used to it. It protects itself up to 2 to 4 weeks after when you do that exercise consistently. So yes, in the beginning you do squats, you might not walk anywhere between 2 to 4 days easily because your muscles are sore. Terrible feeling, but most of us are looking at it like, oh, I did something. And yes, you did, but it's not a gauge of whether you made progress or not. Like I said, over time you're going to be sore less. And when you go, some people will search trying to find that point and they will beat their body up, push too hard, and not get the results they're looking for long term because they're trying to find that soreness. Soreness just means you did something you're not used to. After that, how you should gauge the quality of your workout is, are you getting stronger over time? Are you getting the results you're looking for? Are you improving your endurance? Are you building the muscle? Whatever your goal is, are you getting that result? And test it over time, that's the sign of a good workout. You should feel pushed, challenged, but you shouldn't feel like you got hit by a truck, and you shouldn't be sore constantly. So don't judge whether your quality of workout is based off soreness or not. Tip number 2, when things hurt during exercise, you are doing one of 2 things. 1, your body's out of alignment, or you're using the wrong muscles. So all the time I hear people talk about their deadlifts, they're sore in their low back regularly, and that's just something that's normal. Actually, Steve, one of our new trainer, he said that before he started with us, his low back used to always be sore when he deadlifted. And since he started working with us, using the right muscles, learning the right technique, he actually isn't sore anymore, and his deadlift has gone up about 50 to 75 pounds, I think. And so Your low back shouldn't be sore after deadlifting regularly. The muscles that you should be using are your glutes and your core. And 9 times out of 10 that day, if we teach people to use those muscles, their back doesn't hurt, they feel great the next day. The other piece of this is that the muscles you use, if you're not in alignment, you can't use the right muscles and you're still gonna have pain. So lunges is a big one. One of our clients, she would always have knee pain while lunging, and I'd look at her hip and her knee and she looked pretty good. And then when I look at the ankle was twisted. Anytime one of those joints aren't in alignment, you're putting torque on that joint and you're gonna cause stress and strain. When we brought her back, got her moving in a position that was all aligned, she's like, wow, my knee pain's gone. So your body should be in alignment and you should learn to use the right muscles. And what we go through and work with our clients to engage the proper ones, and we teach them to use all the right places. So if your trainer isn't doing that with you, make sure you find one that knows how to get the muscles to work correctly and gets you moving at your best so you don't end up needing surgery or something else. And the last tip is just be aware that from time to time you may strain some muscles on your body. If you're moving long term and you're trying to push yourself and challenge and get better, there will become a time that you will strain something. If you're doing it right, it shouldn't be significant and your body's going to recover from it. But just be aware that it shouldn't be a consistent thing. I haven't had a strain in probably the last year and a half now. And I've had maybe 3 or 4 from lifting pretty heavy weights over time. But it's not a regular thing, and I'm constantly learning how can I get my body to move even better. And lately it's been feeling the best it has in a long time. So yeah, you may, if you're pushing yourself, challenging, you may strain it. It's not a big deal. The body is very resilient, but it shouldn't be something you're experiencing regularly. You should feel good when you move because the body's designed to move. I hope that these ideas help. You get some ideas on that pain isn't something that you should experience regularly. If you are experiencing pain while moving or lifting, it's because you're not using the right muscles or your joints are out of alignment. And then the final thing is that soreness is a terrible way to gauge your workouts. So stop trying to push your body to find that soreness point and just gauge, are you getting stronger? Are you making progress? And that's going to have the best impact on the way your body looks, the way your body feels, and gets you the best long-term results. If you think this video could help somebody, please share it and leave a comment on this video if something in here stood out to you. Talk to you guys soon. I'm Cade with Cade Fit. Once you get stronger, life gets easier.